Jimmy Carter's extended stay in a hospice busts misconceptions around terminal care. June 24th, UP. According to specialists who spoke with UP, although former President Jimmy Carter's 16-month stay in hospice makes him an outlier, it also emphasizes the complexity of end-of-life care and busts myths about it. Carter, who turns 100 in October, decided to stop receiving rigorous therapy for his malignant melanoma and entered hospice in February 2023. Despite his choice, Dr. Joan Tino, a geriatric care specialist and former hospice practitioner, noted that his senior age and more than 5 years of disease survival should be viewed as a success. In an email to UP, she said, "President Carter is an exception in that very few hospice patients make it over 15 months. The fact that he has lived so long on hospice is testament to his excellent medical care at home, and, if I had to guess, his will to live." Tino continued, "It also demonstrates the fundamental purpose of hospice, which is usually directed toward individuals with a projected life expectancy of 6 months or less, for whom treating their underlying illness is not an option." According to the Hospice Foundation of America, the strategy places a strong emphasis on quality of life and symptom control, particularly for pain. The senior medical officer of Hospice Foundation of America, Angela Novas, sent an email to UP stating, "Although the organization has worked for more than 40 years to educate people about the many benefits of hospice care, most Americans don't engage in advanced care planning and know little about care options at the end of life. Because of that, there is a lot of confusion and misunderstanding about what hospice is, the care it provides, who qualifies, and how to access care," she stated. According to the National Institutes of Health, over 90% of patients who receive hospice care pass away within the first 6 months, and almost 40% do so within the first week. However, since going into hospice care, Carter has commemorated his 99th birthday, grieved the passing of his longtime spouse, the former First Lady Rosalind Carter, and even managed to attend her funeral with help. "I believe that President Carter is pursuing the course of metastatic melanoma, which results in increasing fragility, where he requires assistance with daily activities and utilizes a wheelchair," expressed Tino, who lacks direct awareness of Carter's health. She stated that the former president is probably sleeping most of the time, citing recent talks with family members. Tino, who is also an adjunct professor of health services, policy, and practice at the Brown University School of Public Health, noted that hospice patients who are not alert and sleeping more are generally nearing the end of their lives.